It was about 40 to 45 feet. I remember seeing my rope go up and realizing I was not going to get caught. You know, the thought went through my head that that was how I die. I was going to die right there. I work for University of Houston in the Outdoor Adventures program at the climbing wall. I like staying in shape, and so it gives me a good outlet for that. I remember pretty much everything that happened that day. We opened up, a few of the staff were late, and we had a lot of maintenance things, some ropes to replace. I accidentally climbed up on a belay device that I'd been using to belay patrons, which isn't meant to hold your weight by itself. I was attached like this when I was climbing, which this is a belay system where you can hold on tight. But when I was climbing in it, and no one was holding on to it, and I let go, it just came out. And so when I climbed up, fixed what I needed to fix, said I was ready to be lowered and let go, I came all the way down.
After Blake's accident or fall, he was brought emergently to Memorial Hermann Hospital here in the medical center and taken care of by physicians from the Texas Trauma Institute. He basically had a partial spinal cord injury, or what we call an injury to the conus. The plan was to stabilize the unstable injury with screws and rods and perform a fusion or weld the vertebra together. And in addition, we needed to take pressure, remove the bone fragments that were pushing on the end of the spinal cord and causing his neurologic deficits and weakness.
I was called to take care of his elbow injury, which has classically been known as a terrible triad, and it carries that name because historically the results from that injury have been pretty poor. More recently, there's been new protocols to help determine how to treat those injuries best. Luckily, we were able to do that, and Blake had a great result in the end.
At 3 months, he was already returning to lifting weights and swimming and running and all kinds of activities. Typically with these injuries, it's really variable if the patient recovers fully from a spinal cord injury or not. He's regained all of his neurologic function that he lost after the fall. We are a trauma hospital, and I think that makes this possible, but it's the people that work here that know what they're doing and allow us to take such great care of patients and to have outcomes like we had with Blake. We have a great rehab program here. They also help our patients with, from the physical therapist to the rehab physicians, after an injury like this and after having neurologic deficits, and they've helped Blake greatly with his recovery as well.
We all are prepared and equipped and trying to deal with anything that comes in the door.
I tell people, if you're gonna fall 4 stories and have a spinal injury, you should do it in Houston. Do it with the best doctors in the world.